Adam is only 12 years old, but he's already an accomplished comedy script writer.
Mommy, look what I just finished typing.
But life is hardly one big joke for Adam. 2 years ago, he was suicidal and had to be hospitalized.
It got very hard for me, and I thought to myself, well, I can't tell my parents. They don't know. Am I ever gonna grow out of it? What's gonna happen? So, and I got very, very depressed.
Adam now has regular counseling and family therapy sessions and is doing very well. Michelle is 18 now, but her depression began many years ago. Michelle did not become suicidal. Rather, she says, she became belligerent and got into fights at school.
What kind of behavior would get their attention?
Fighting.
Fighting?
Skipping school, bad grades, yelling, screaming, cussing.
So those things got attention. Skipping school, screaming, yelling, fighting, bad grades.
Exactly.
Michelle and Adam are just two of the millions of young people who will be diagnosed with depression during their childhood and adolescence. Depression is a normal psychological reaction to loss or to a dramatic increase in stress.
If there is a change at home where the stress level goes up very high and we see a change in the child's behavior, that's one of the places to look. So if there's a divorce or an imminent separation, if there's the loss of a job of a parent, if one or the other of the parents is diagnosed with a serious medical disorder or mental health problem or depression.
Depression becomes a problem when the reaction to loss lasts longer than normal and the child's behavior begins to change significantly.
That's probably the signal that is most important. You see the child whose sleeping habits change dramatically, who has a dramatic change in their appetite, whose friendship patterns change, whose grades start to decline.
Sometimes, as with Michelle, fighting, anger, and belligerent behavior are symptoms of depression.
To remember that that can attract so much attention, that is the misbehavior, that we don't look underneath it, and that's the feelings of the child that may be promoting that behavior, and that can be the depressed child.
The usual treatments for children and adolescents are psychotherapy, family therapy, verbal behavior therapy, and occasionally medication. While each case is different, usually a couple of months of treatment is what's needed to get most cases of depression under control.
It is much better to have a session with a pediatrician or to have a session with a psychologist or psychiatrist and have that professional say, you know, this is not something we really want to worry about. Everything's fine, this is a little thing, take this home. It's probably better to have that checked out if you have a concern and there's even any kind of statement about harm than to go the other way and have a serious either loss of life or injury that occurs because that statement was ignored.
Untreated depression can greatly increase the risk for suicide, which is now the third leading cause of death for adolescents. Boys are 6 times more likely to commit suicide than girls, and the mere presence of a firearm in the home significantly increases the risk that the child will attempt suicide and be successful. Experts encourage parents and caregivers to be proactive with their children and ask questions.
I've worked with many children over the course of a 25-year career in psychology. I've asked many of those children on a regular basis, do you feel suicidal? Have you had thoughts about killing yourself? Do you sometimes feel as if life isn't worthwhile? Never have I had a single one that said, what a good idea, I think I'll do that. It's not going to put ideas into kids' heads if they're not already there, and it can be a protective factor. Ask your kid if they've felt that way. If they have, get some help.
Experts say the overwhelming majority of those treated for depression can recover fully, and virtually everyone can be helped to some degree. And the best advice? Talk to your child.